SB2704 is an annual inspection of the infirmary at the state penitentiary, which we need. I just want to make sure that you're not confused on which bill. We had a health care bill earlier in the year, and this is not the same thing. So the thousands of people with Hep C won't be treated because this is not the bill. The women that have cervical cancer and who will die for not treatment, this is not the bill. The 23-year-old black female, beautiful girl that raised her shirt up to me in the prison and showed me that she had breast cancer growing out the side of her chest will not be treated in this bill. This I got this week from an HIV patient that's not being treated and not getting medicine for HIV that will save his life is not in this bill. And this goes on and on and on, yet we're spending $120 million on health care, and we are not getting patients treated, inmates treated. Thousands of Hep C is a public emergency. They will die. You get a 10-year sentence and you have hepatitis C, you will die before you get out of jail. So I just wanted to tell you, we need this bill because all this bill does is go in and make sure that the medicines they have are up to date and the areas are clean. This is just like any kind of public health bill, but I just need you to know that we're not forcing them to do their job and take care of the inmates. Final passage.
Lady from Jones, Ms. Scott.
Thank you so much, Mr. Speaker. I wanted to see if the lady would yield for a question.
Yes, ma'am.
Now, lady, you gave several very disturbing examples of what is going on at the infirmary at the state penitentiary. Now, can you tell me, is this annual inspection outside of the normal inspections that are supposed to be conducted at the infirmary?
They have no inspections.
Now, okay, lady, now, how is it that, well, let me ask you this. Does the state of Mississippi bill for any insurance or anything like that for any inmates?
No, we pay out of the general fund.
So we pay all of the money out of the general fund. So is it your assertion that if your bill had passed, that there's a very real possibility that this $460 or $70 million budget, that of it $120 million is used for health care, could be reduced some?
Well, after we got them all taken care of, it would reduce our health care budget tremendously, but we're not going to be able to reduce the health care until we get the population healthy, which they're not right now.
And so even if your bill had passed, even when we put people in isolation and those kinds of policies that would be put in place for cost-cutting measures, that would have made the infirmary at the penitentiary more safe for people, right?
It would make the penitentiary more safe because these are infectious diseases.
Okay, and so my last question to you, now lady, are you aware that there has been a $117 million reduction in funds over at the health department? And I read somewhere, some of these people in here I think wrote it, it might have been New York Times, but I think it was one of them, that said that the sexually transmitted disease and the infectious diseases, those programs would be impacted through our health department because of the reduction in funds?
I'm sure they will, lady, but and
so let me ask you this.
Okay.
So if the health department goes and makes an annual inspection and they determine that there are areas of deficiency, what is the next step for the Department of Health?
Well, they'll give them probably a C like they do in restaurants. This is all we're talking about. They will not have access to medical records like my bill wanted them to. They will not have access to inmates, which is how I found out all these things. And all you're doing is saying, yes, you have a clean infirmary. This is just like a regular everyday inspection, but it does nothing to benefit the health at the for inmates.
And this bill, as you say, there's not any recommendations to be made to go forward to make corrective action. Like if you would go to a hospital, nursing home, dialysis clinic, anywhere where they go in and the health department itself, the health department itself goes in and makes these types of inspections, right? And so if they were to go and do that, then that would be an expectation of a corrective plan of action, right?
Lady, you know, you've been in healthcare a long time. You know when the State Board of Health comes in, they have a checklist. This year it may be because they are checking to see if you have fingernail polish remover. It's just a very lightweight, come in, is it clean? You know, but they are not checking anything other than the cleanliness, just like you would in a restaurant.
And because this is not a licensure issue, I guess that's the question I should have posed to you.
They have no license.
This is not a licensure issue.
Well,
then the House needs to know that they don't do the in-depth.
That's what I'm saying. We need this. I'm all for this bill, but we're not doing the job we need. And speaking of licensure, I don't believe if you go in and look at medical records for inmates that you will see all of these illnesses in their chart. I do believe the Board of Medical Licensure and the Board of Nursing probably need to go take a look.
Thank you. Thank you.
Gentleman from Washington, Mr. Bailey.
Question to the lady.
Go.
Lady, let me ask you this. How long you been in this body?
This is my 18th session.
Do you get the feeling that the Senate does not really respect us and respect the authority that we have on this side?
I don't know. I don't know about that.
Well, you have to answer this. Why do we continue to pass and take up their bill when they kill our bills?
Well, there were several hands in the killing of that bill.
That was a good bill we sent over there to help the people.
That's correct.
And they killed it.
That's correct.
And yet we over here advancing bills over here that don't do much of anything. We're trying to advance that in the name that we are legislating down here. Who are we fooling?
Well, not all of us.
Gentleman from Harrison, Mr. Hullum.
Yep, gentlelady, do you yield?
Yes, sir.
Question: how much do we pay private prisons in the state of Mississippi?
10% less than the other prisons, but it's still the same health care.
You know what I'm saying? What's the dollar value that we give?
I don't know that, sir.
Okay. So the reason I asked that question because the amount of money we pay for for-profit prisons, private prisons in Mississippi, if we were to use that money for health care of the inmates who going in there that have not received a life sentence that's going to come back out to society, wouldn't that put more money back in Mississippi tax base?
Yes, sir, but you have to understand, we do pay for the health care. I have no idea where the money's been spent. So as far as I'm concerned, we're just not taking care of inmates and their health care needs. But we do pay for health care out of the general fund. So they have the money. And the comparison to the bills is just that we wanted to make sure that they got the care that they need. That they need so they don't die.
So if I'm hearing you correctly, the Christian thing is that we like to float in Mississippi. The Christian thing is we should do everything we can to take care of the people that's above ground, even if they're incarcerated, correct?
Yes, sir. I will tell you that my Christianity is the reason I'm standing here today saying this. Because I can tell you, if you read Matthew 25, verse 36, verily I say unto you, What you do to the least of them, you do unto me.
Okay, I got, I've been to war 6 times. So I need you to say that one more time so I can hear it. One more time, please.
Verily I say unto you, what you do to the least of them, you do to me.
Thank you, ma'am.
Gentleman from Marshall, Mr. Faulkner.
Thank you, Mr. Chairman. Mr. Speaker, Lady, you yield?
Yes, sir.
I echo the sentiments of the senior gentleman from Washington when he talks about how we have a really good piece of legislation that dies a slow death on the other end of the hall. And I know how hard you worked on these bills, so I'm disturbed as well. But my question about this particular bill, so if the inspection is done and there's a letter grade, you say like A, B, C, so if you get a failing grade, what happens next?
Well, they would have to go back and re-inspect. They would give them things to do, and they would have to improve on that. But this is not direct health care. This is just the facility.
So again, it really doesn't do much.
Well,
We need it, but it doesn't do
does get
much.
them in there,
Thank you.
Gentleman from Hines, Mr. Brown.
Thank you, Mr. Speaker. Madam, allow for a question?
Yes, sir.
I want to commend you for your commitment to improving our prison system, but this bill apparently is more of a hygiene type of a bill
That's
than one that's going to improve the health care of the inmates. Is that right?
That's correct.
Okay. And what prompted you to bring forth this
I did not.
initiative?
I did not bring forth this. I brought forth the other bill after seeing so many inmates that were in need of health care that were not receiving it. But this bill is, I did not bring this bill forward.
Thank you.
Gentleman from Prentice, Mr. Arnold.
Thank you, Mr. Speaker. Gentlelady Yield.
Yes, sir.
Gentlelady, this medical care or the lack thereof is provided by company, correct?
Yes, sir.
Is that something that they do through a contractual process?
Yes, sir.
Do they bid on that contract?
Yes, sir.
Do you know the name of the company that's providing that health care at this
Vital
time?
Core.
Who's that? Anyone own that? Who owns that company? Do you know?
Someone out of state.
Out of state folks. Okay. I share your concerns with the people that are inside those walls, and they may have committed some crimes and done some bad things, but they're still human beings.
Thank you.
Thank you.
I don't see any further questions. Move final passage.
Final passage.
Open the machine, Madam Clerk. Has everyone voted? Has everyone voted? Has everyone voted? Close the machine, Madam Clerk. By a vote of 108 yeas, 4 nays, bill passes.